Hello all, I am Dr. Walter from SNS College of Physiotherapy. Today we are going to see a new video based on the spinal cord injury. As we know what is spinal cord, what and all injuries which will happen in the day-to-day life. Starting from a day, from the morning till evening or till night, we will be hearing a number of accident cases in our physiotherapy field. While we are working in a hospital, we can able to see a number of accident cases, either by burns or by road traffic accidents or by fall from the height or assault or a trauma. Anything will happen. Okay, now we are going to take a peculiar term, that is a spinal cord injury. So what is a spinal cord injury? We will enter into the video. Okay, first one is the introduction, the connection between the brain to the spinal cord. Okay, so this spinal cord plays a vital role in the movement, in the sensation, and all the balance, maintenance, and all these things. The spinal cord plays a vital role. So it will send the signals to the brain and receive the signals from the brain to the spinal cord, transmit the motor and the sensory. All these things which we have learnt in our earlier classes. Okay, so the motor skills and the sensation skills plays a vital role in this area. Now we are going to the SCI types. What is SCI? That is the spinal cord injury. It is divided into two types. One is complete spinal cord injury and one is this incomplete spinal cord injury. As it is, we are going to learn a small topic on the SCI. What is incomplete? That is, the injury might have happened in the spinal bone, but the cord will go for an incomplete injury. A little bit of cord will go for the injury compared with the complete. Complete means it will be going for a complete cut. It will cause a greater fatal effect for the particular patient. How these things are happening? Causes is due to the road traffic accident while going in a bike. As we are using a modern technologies of bike, which will be going in a very fast of speed, and in another hand we will not be using our helmets, and all these things will end up in a road traffic accidents. Falls, most commonly the persons who are going to commit suicide will be falling from the height. They will be developing the spinal cord injury. Most commonly falls will go for spinal cord injury. Otherwise, patients, geriatric conditions who are walking, they will be going for falls. It will also reflect in the spinal cord injury, but it will go for a minimal content. Sports injury. So football is a major important sports. In that case, spinal cord injury will be happening. As we all know, a famous football player who have encountered with the spinal cord injury on the field itself. So he went for the surgery and he went for the rehab of physiotherapy. Now he is also playing again in the field. There is a greater achievement for the physiotherapy field. And the trauma, it is due to any type of blunt injury or assault injury. It will reflect in the spinal cord injuries. Now we enter into the rehabilitation. So here I have listed a number of rehabilitations here. Okay, so the position, the mobility, the strengthening, the balance, the transfer. Compared with the points which I have written here, there are a number of things which we need to do for a spinal cord injury patient. Okay, positioning a patient. For example, if the patient is going for a paraplegia, both the lower limbs will not function. In this case, the positioning of the patient is most important. Why? Because if the patient is on supine line for a longer period, the bed sores, the most tragic things will happen for the corresponding patient. As a physiotherapist, we need to take care of the patient's hygiene and the health. So the positioning, that is the rolling, the shifting should be happening for the 30 minutes every time, or 1 hour once the positioning should be done. Mobility. If the patient is going for the paraplegia, the mobility of the both lower limbs should be done, like the passive range of motion exercises, the passive exercises which a physiotherapist should do to the patient. If a physiotherapist is not doing the mobility for the patient, the muscle will go for the weakness. So it will endanger their corresponding muscle strength. The strengthening exercises, as we know, the spinal cord injury in this case, if it is going for incomplete stage, the paraplegia will not occur, it will go for the paraparesis, that is the weakness of the corresponding muscle. With the help of tumbles or with the help of sandbags, we need to strengthen the patient. It is most important. But in the case of complete SIE, it is impossible to do the strengthening, but with the help of the passive assisted, we need to do some strengthening exercises. Balance and transfer is most important. If the patient is in the paraplegic state, we need to transfer the patient from the cot to the wheelchair and wheelchair to standing. All these transfer techniques which we need to learn in detail in our gait lab. As we are having the wheelchairs in our gait lab, couches in the gait lab, we need to make a model and the transfer technique should be learned in detail so that no null error will happen in this cases. Balance, if the patient is in incomplete SCI, now after strengthening he or she is going for the standing, the balance training is most important with the help of the parallel bars and the wobble boards and a number of balance technique we need to do, and for this we can analyze with a number of questionnaires as outcome measures. Hope you might have understood all these things in the SCI in a basic thing. Now we need to learn more about the SCI, about the physiology of the incomplete and the complete injury, the more advanced techniques in the physiotherapy field, so the VR and a number of techniques which we are going to use in our day-to-day life. Hope this video will be useful to you. So kindly go on through this video, learn the contents and apply in your day-to-day life.